All right, let's get started. So good evening, everyone, and welcome to AOTA's Practice Chat, which is jointly sponsored by the Special Interest Section Communities of Developmental Disabilities, Home and Community Health, and Rehabilitation and Disability. For those of you who are new to AOTA's Practice Chat, welcome. And for those of you who have participated in previous Practice Chats, welcome back. On behalf of AOTA's Home and Community Health Special Interest Section, my name is Michael Lopez, and I will be introducing our guests this evening. We have a great chat planned for you, and I'm very excited to hear from our guests. This chat will be guided by the co-facilitators of the Emergency Response and Disaster Management Community of Practice, Dr. Emily Balog and Mary Schmitz. Their presentation will explore the unique preparedness needs of vulnerable populations, examining what is known and unknown about real-world challenges faced by clients across the lifespan. The discussion will emphasize the critical role of occupational therapy practitioners in disaster and emergency management, framed around the 4 phases of FEMA's disaster management cycle. For example, we will cover practical applications such as developing emergency plans and creating occupation-based go bags or kits. Additionally, we seek feedback on Project Protect, our innovative community-facing program developed through connections within the emergency response and disaster management community of practice. Before we dive into tonight's topic, I would like to review some housekeeping items to ensure our call runs as smoothly as possible. If you are on your phone and you haven't done so already, please press mute. If you are on your computer, please mute your microphone. Only the person currently speaking should have their device unmuted at this time. Now it is my pleasure and honor to introduce our guest. Dr. Emily Balog has been an occupational therapist since 2006, earning a Bachelor of Science and Master of Science from Thomas Jefferson University in Philadelphia, Pennsylvania. She enlisted in the Air Force and received her Associate of Science in Emergency Management from the Community College of the Air Force, where she led didactic classes and boots-on-the-ground training on preparedness and response to nuclear, biological, chemical, and radiological warfare and natural and human disasters for 6 years. Her wartime role involved plans and operations for base preparedness and plotting disasters and communicating with recon teams for appropriate action. Dr. Balog earned her PhD in Translational Health Science from the George Washington University in Washington, D.C. She leads the effort for Project Protect, employing an evidence-based approach to enhance community readiness through force multiplication. As legislative co-chair for the New Jersey Occupational Therapy Association, Dr. Balog is actively involved in state advocacy efforts aimed at advancing the profession. Dr. Balog is an assistant professor at Rutgers, the State University of New Jersey, where she teaches theory, professional issues, older adults, and health policy in the occupational therapy doctoral program. She has developed innovative opportunities grounded in theory, evidence, ethics, and advocacy, enabling students to become leaders capable of translating their skills into impactful policies and practices. Welcome, Dr. Balog. Mary Schmitz is an experienced occupational therapist with a long-standing history of working in the health, wellness, and fitness industry. Not only has she demonstrated knowledge in disaster management, addressing occupational readiness, response, recovery, and mitigation and direct client-centered treatments, but she also has provided individual and community education and training passionately over the last 7 years. She is a strong healthcare services professional with her bachelor's from the University of St. Catherine and her doctorate from Quinnipiac University, both focused on occupational therapy. Immersing herself in active professional and community engagement through volunteer efforts, which include holding the position of secretary of her local community emergency response team, volunteering with Mojave County's Medical Reserve Corps, founding and chairing the Arizona Occupational Therapy Association's Telehealth Special Interest Section, as well as a pediatric school-based SIS, and co-chairing the Home Modifications SIS, all while contributing to the annual conference planning committee, legislative committee, and advocating for OT utilization and multi-tiered systems of support in rural school districts across Arizona through her activities in the Arizona Rural Schools Association. Most recently, Mary has been collaborating with behavioral health professionals and the state's Medicaid program to identify how occupational therapy can fill the gaps by addressing the action components that support individuals throughout the lifespan, utilizing the power of occupation, health-directed habits, and routines while supporting the cultural and gender diversity that makes us individuals. Welcome, Mary. Thank you again to our guests for participating. Audience members, if you haven't done so already, please mute your microphones.
Welcome again. Thank you for the introduction. And I'm really excited to be able to share our information with so many of you. And at any time, at least when I'm speaking, please feel free to stop me if you do have questions. I'll try and keep an eye on the chat. So just as we get started, we have a question for you. So get ready to answer it in the chat. So thinking on a scale of 1 to 5, again with 1, nah, not so important, and 5 being extremely important to you, how would you rate the importance for planning for emergencies? I wish I had the Jeopardy kind of song going. Boy, are those the answers we like to see for people that are attending and participating tonight. That's awesome. If you asked your next door neighbor, do you think you'd get the same answer? Unfortunately. Oh, good. Somebody has a good next door neighbor that's on top of it. Couple of you, great. Do you live near each other? Well, we're going to delve a little more into this of how we can be active leaders in increasing the importance that others will see and find in planning for emergencies. If you want to advance the slide, Emily. So tonight our learning objectives, just very clean and clear here. We're just looking at trying to see how we can all learn to contribute to personal and public health, safety, and really doing it through training regarding engagement in disaster preparedness. And then identifying the steps that we can take ourselves first, and then be able to transfer that into our communities. And then provide reflective feedback regarding one's own emergency preparedness, as well as how well suited we as occupational therapy practitioners and students can become to later provide this proposed training of Project Protect at the community level. So when we think of trying to get others to engage and to validate what we need to share and know, as an attendee, you have an active role. You need to be engaging in this learning process and thinking about how it's relevant to anything in what you do, because this may be a new level of knowledge to add to your practice. And we want you to be questioning your role and see if you could be future ambassador for our community safety and preparedness. It's Susan Basic that really emphasized the active engagement as essential for knowledge translation and learning through practice reflection. So that's what we're challenging you to do tonight and beyond, of course. So when we think about FEMA, they are our partner in understanding disaster and emergency management. And they have 4 specific phases. And it's a disaster or emergency management cycle. And the 4 phases are going to be defined here. So for instance, with mitigation, when we think of mitigation, it's simply involving efforts to reduce the impact of future disasters by taking proactive measures. You're not waiting for something to happen and then react. You're getting things in place. And this can include building codes and land use planning, flood defenses, earthquake engineering, and improving the resilience of critical infrastructure. Many times it's improved upon because what has already happened. So you may see that something didn't work as effectively when the area was hit with an emergency or an actual disaster. So you improve upon what the potential actions will be that will prevent a similar outcome. Or if you had success, then you may want to just spread the success. With preparedness, this phase really involves planning and preparing the activities to ensure that individuals, organizations, communities are ready to respond should a disaster occur. And these activities can be simply starting with developing an emergency plan. What would you do? Where would you go? What do you need? Conducting drills and exercises and actually practicing them. Training responders, establishing lines of communication and what those evacuation routes would be. It's really important, though, that it's not just the planning aspect. You've got to practice it so that in the moment, if this should really happen, you can execute it. Not think about, well, I was going to do it, but I never thought it would happen. But you really do have to think as if it may happen to you. Next slide, please. So the other two phases, response, that is actually the one that we hope we don't get in the midst of. But during a response phase, it's those immediate actions that you have to take to ensure your safety and the safety of those around you and provide emergency assistance so that you minimize any further damage in the aftermath of a disaster or in the midst of it. And it really includes things like search and rescue. It could be providing medical care. Maybe you're an OT that operates out of an ER, distributing emergency supplies and securing temporary housing. Maybe you're the one receiving somebody at those emergency shelters or in the recovery phase. That is the phase where we focus on restoring the affected area back to normal or a new normal, and maybe even a safer condition. And it involves rebuilding the infrastructure, restoring the public health services, providing financial assistance to individuals or the businesses, and implementing mitigation measures, again, that would prevent future disaster. And so you'll see it's a 4-phase cycle, but you may meet somebody at any point. It doesn't go in a sequential order necessarily, especially for us as OTs. We're going to find that somebody may have experienced a disaster 15 years ago, and in their mind, they're still in a recovery phase. So we want you to think through all of these as being ongoing. It's cyclical, but never ending necessarily. So we want to look at risk reduction and what are the key strategies for us as OTs? First of all, what is risk reduction? Now we want to realize what actions can really be taken that can minimize the impact of those disasters, especially on the vulnerable populations. We want to be proactive and address those environmental changes that can be implemented and personal risks. So when you think even further through this, what could you do that can make this more effective? Risk reduction really refers to minimizing the potential harm. And so you want to think about how this is central to the phases we just mentioned, and the mitigation and preparedness. But still, it influences the other phases as well. So let's take a little closer look at it. So what are some of the ways an OT practitioner, do you think, can facilitate risk reduction in mitigation? You can enter in the chat here just a few ideas. Trying to get you guys to critically start thinking here, so I'm not just talking. So think about, again, OTs in that mitigation state. True, education could be a way. Yeah, assessing environments and resources. So definitely environmental modifications. Say in a earthquake prone area, you might, if you're a home health OT, be working with your clients to secure furniture so that, they're safer environments. Advocate for accessible infrastructure. Boy, I can't talk today. Infrastructure in community planning. Yeah, definitely. Anyone that has limitations in access on all levels. Cultural competence, very important. So putting in strategies and interventions, we can do that in any setting that we practice as therapists. And that's one of the things that we want to try and get across to all of you is you don't have to be necessarily a volunteer with Medical Reserve Corps or community response teams or something, just in your everyday interactions. So if you think about now in the preparedness phase, what makes that a little different from mitigation? Give you a hint. Practice. Any ideas of some things that you might do? Definitely. Good answers of the checklist, simulation, and drills, writing out a plan. Preparing a go bag. Excellent. Some people start developing their contact lists, how they'll communicate with friends and family should an emergency occur. Very good. So when we think of our role, you know, educating our clients on that, being able to create occupation specific plans, being able to get those kits together, including whether it's medication, whether it's communication devices, if they need assistive technology or DME of any kind. And at a community level, we can lead, training sessions, inclusive planning, that accounts for the wide variety of abilities. How about going on to the response state? These are the active measures. So what could we be doing as OT practitioners that would reduce risk? Well, hopefully the training may have occurred already. So now they're actually implementing it. Or if we saw somebody in action, not doing a transfer safely or acknowledging some differences, definitely. Yeah, some of the, response could be in the moment. Mental health, so true. I think you guys are getting a good grip on all of this. And the last one for in the recovery phase, really we're looking at addressing long-term risk reduction that promotes the resiliency of a community and of the individual. So what do you think the OT roles could be there? Anybody have some? Yeah, returning to their occupational roles. Or in the case of somebody that has suffered a loss, maybe it's a new role. Yeah, we might be advocating for improved settings within the community, whether that's the infrastructure or, other planning, creating, yeah, with new habits and routines, definitely. Right. I think you guys really are getting the idea of what we have to do. The modifications, whether it's to a home or a community center, and the supports, definitely. All right, should we move on?
We sure can. Thank you so much, Mary, for leading us
Woohoo.
off in a very engaging presentation. So I'm just curious, I feel like we use this term adaptive capacity, and I'm wondering if you know what that means, and if you could maybe give a definition or describe how maybe you've used that with a client. What adaptive capacity is, and that's okay too. So adaptive capacity is a person or community's ability to adjust and manage challenging situations like disasters. And we emphasize flexibility, resilience, and self-sufficiency. So in the FEMA disaster management cycle, adaptive capacity is relevant in every phase because it enhances both preparedness and the ability to recover from those disruptions. So as occupational therapy practitioners, we want to be thinking about how individuals and communities can acquire, improve, or retain the skills, knowledge, tools, and resources necessary to cope with the impacts of emergencies and disasters, and what we can do to support that knowledge, skill, the tools, and resources. So similar to the exercise that Mary just provided, I'd like to think through adaptive capacity within each of the phases of the cycle. So how would an occupational therapy practitioner use adaptive capacity in a mitigation phase? Reducing adverse effects of a condition, identifying resources and putting at-risk people in contact with support systems, assessing the resources currently available. But remember, the adaptive capacity aspect is helping individuals and communities to build their self-sufficiency, right? So self-sufficiency within, for example, hazard identification, knowing where you live and what potential disasters, natural disasters might occur in that community. Understanding how adaptive devices can be used, how to promote accessible spaces. And then at a community level, we might advise on structural modifications or advocate for policies that make environments safer and more adaptable to risks. So let's take that a step further now, and let's think about what occupational therapy practitioners can do to promote adaptive capacity at the preparedness phase, which is looking at equipping individuals and communities with the skills and resources to face those potential disasters. And I know these are hard questions. You are doing fantastic. So I'm seeing doing some action planning. So some of the things I want you to be thinking about, there you go, Alexa, teaching adaptive skills such as navigating public transportation systems or mapping medical equipment in a disaster. Yes, exactly. And so there is a nuanced difference between the risk reduction and building adaptive capacity, but there's a lot of overlap. So things like, as you mentioned, training clients on adaptive skills, like using assistive technology, identifying safe locations, and planning evacuation routes, are all ways that we can work with an individual. And then in terms of community organizations, we should be collaborating with them to establish training programs and encourage broader community engagement and resilience. And so how about the response phase, where the focus is immediate action to ensure safety and managing the impact of a disaster? What would our role be there? How do we build adaptive responses or adaptive capacity during a response phase? Yeah, ensuring that people have access to essential equipment. Excellent. Implementation of equipment. Yeah. One other thing that we do really well is to quickly assess someone's functional needs, right? So in that moment, understanding what it is that someone might need, and then ensuring they have access to, that equipment that you all were mentioning, those accommodations and shelters, those access to transportation. Yes. So we would quickly assess those functional needs and then assure that access, and then help individuals utilize those adaptive strategies. So at a community level, we can collaborate with first responders to make emergency response inclusive and accessible. So how about for the recovery phase? The recovery phase is looking at restoring normalcy while enhancing resilience for future events. So what would our OT role be during the recovery phase? Thinking about that resilience. Yes, exactly. You got it. Addressing mental health needs, potential PTSD, learning from past mistakes, excellent, and making adaptations to future plans. Very, very good. Yes, that's exactly right. So occupational therapists can help to integrate those adaptive strategies into new routines, reestablish safe and accessible environments, and support psychological resilience. You have all identified exactly, Alexa. Yeah, you all have identified some excellent ideas and strategies. And so really, we want to be thinking about individual and community. And at a community level, in terms of recovery, we might engage in recovery planning, advocate for resources, help address long-term needs related to disability or mental health, and then facilitating a return to daily life. So all in all, adaptive capacity is an ongoing process across the FEMA phases, with occupational therapy practitioners acting as facilitators of resilience at both individual and community levels. And I'm going to turn that over to you, Mary. You're on mute.
I just realized that mutant makes a difference. So let's take a look a little further at how we can build resilience. I mean, it's a term that we all use. And so we just got through identifying the adaptive capacity, risk reduction. So thinking about the adaptive capacity, how we as OT practitioners we really have an exclusive role to empower clients to manage their daily activities independently. That might mean using adaptive devices effectively, practice preparedness techniques, that really will enhance their confidence and their readiness for any unexpected events. What a cool role we have. And then through the eyes or the lens of risk reduction, just like many of you identified, we're assessing the environments. We'll assist in creating personalized emergency plans that really can address our clients' physical, sensory, cognitive needs, and really helping to minimize their vulnerability during the emergencies. Now, by the same token, on a community-wide resilience building type of situation, what kind of collaborative initiatives could we be involved in? We worked with, as some people mentioned in responses, was emergency response teams, working with community leaders, advocacy groups, and these all help to ensure inclusive preparedness planning and accessible resources. Now, education and training, offering training sessions on adaptive capacity and risk reduction. OTs can also raise awareness and educate community members and stakeholders, improving overall preparedness and resilience of a community. And then advocacy. That's kind of like our second side of what we do for many of us is we're advocating for policies. And then that really address those vulnerable populations and prioritize accessible infrastructure, adaptive equipment, disaster resources, and helping to build more resilient, inclusive communities ultimately. So now when we look at integrating these into our daily practices, what can you think of for if you were going to put like the top 2 daily practice tips for OTs, what would you guys put? If you could just put that into the chat. One of the ones I would think of is that I would update emergency plans with clients. As the weather changes for each season, there might be more issue for potential emergencies. But put your ideas in before I go on. Don't be shy. Definitely looking at their living environment. Yeah, they may have a plan, but is it something that can be carried out? Definitely to see if they're viable. I know I used to work in home care, and we had nurses that would tell me, oh yeah, I've gone over the emergency plans with the clients. It's in their intake folder. And if you ask the home care client where that intake folder is and what their emergency plans are, most of the time that's not top on their list when they're recovering from something that required the home care team in. So think of some other things. We've got, renewing medication, reviewing those kits for anticipated issues. Yeah, food expires. We got to double check those things. Yeah, evacuation routes. So, going through these things to make sure that everything is accessible and relevant in that moment for that client, because they may have a plan, but now they've had a total hip replacement and they may not move in the same manner. So also we could create what we may term micro preparedness routines for our clients, like practicing safe routes, preparing their emergency contacts. But ultimately, we want to support client autonomy. We don't want to necessarily do these things for the client or have their family do it to them. You want to be able to empower them to participate actively by building small, actionable steps and build it into their daily routines. Definitely, we got to be aware of who is supporting the individual. Sometimes clients can't be fully independent and they do need to rely on others. And then we also, as professionals, let's look at our interdisciplinary opportunities for collaboration. You know, who are some of the individuals we may want to partner with? Who are some of those other stakeholders? Ideas? Kind of a no-brainer are our first responders. Yeah. Other therapists. Yes. Case managers, definitely. Social services. Any community organizations that you may have. Yes, agency on aging can be a very good one. Yeah. Individuals, extended family, look at, what are the resources in the area and who runs those shelters? Is it the Salvation Army? Is it the Red Cross? Is it, Catholic Charities? Who are the other involved organizations? And nonprofits, definitely. All right, let's move on.
Okay, this question's going to feel like it's out of left field. So bear with me for a moment. Have you ever participated in a CARFIT community event as a participant, a coordinator, a volunteer, etc.? Or are you aware of what CARFIT is? I see some no's. Okay, so a few folks have. For those of you that are saying no, do you know what CARFIT is? So for those of you who might not know what it is or have never participated, CARFIT is a AOTA-sponsored community-facing event where you become occupational therapists and students have the potential to become CARFIT technicians, where they learn materials online through an online educational didactic platform. Then they have to participate in a lab where they would apply those skills, and then they can go out into the community and conduct those skills. And as I mentioned, that seems a little out of left field, I know. But I will come back to that momentarily because I want to introduce you to Project Protect. Project Protect stands for Project Preparedness, Response, Recovery, Occupational Therapy, and Emergency Context Training. And it was developed by a group of individuals. We all met, well, not all of us met this way, but many of us met through the community of practice. And through that community of practice, we developed some content to present at American Occupational Therapy Association conference last year. And from that, we then developed Project Protect, or in the process of developing Project Protect. And one of the things that we really recognized was that CARFIT is a really successful model for community-facing education. And so we really wanted to adopt a similar model in emergency preparedness. So in the way that we look at a person's vehicle and their safe fit within a vehicle, we want to apply that to development of emergency plans and emergency kits for the vulnerable populations that we serve. And so we saw this as a potential model because it's a joint collaboration opportunity with community partners. It presents a shared value for community safety. It's structured as a multiple community education event, and it's adaptable for either community or one-to-one. And so some of the guiding goals for the development of Project Protect is to create this structured approach, and then to equip occupational therapists, occupational therapy students and OTAs to be prepared with specialized knowledge and skills in emergency preparedness so that they can serve their communities effectively. and then enhance the capacity of the OT profession to provide this information with a public health lens through community engagement and disaster preparedness, and then foster this network of prepared occupational therapists to go out to vulnerable populations during all 4 phases of the FEMA cycle. And so what we have done is we are continuing to develop Project Protect, and we've really thought about, guiding theories that we can use to help us to develop this. And so we've identified 3 occupation-based theories, and we know there's no shortage of OT theories. So it's certainly important to keep in mind, theories that you would apply to individual clients. But for the purposes of Project Protect, we really want people thinking about PEOP, occupational adaptation, and occupational justice. When we think about PEOP, we're thinking about that intersection between the person, the environment, and the occupation, where these ecological models really can help us to focus and emphasize on communities and environments, right? So coming out of the disability rights movement, it's that we don't necessarily need to change a person to fit the environment, but that these environmental features can affect social participation. So we want to ensure that the community environment is supportive of persons with disabilities. Additionally, we want to be thinking about, people and populations and assessing the needs of those individuals and populations within the community, because they're going to vary across communities. We want to think about what environmental contexts are barriers to response. What environmental hazards exist? How can the environment be adapted? What occupations will be affected in a disaster? What will people need assistance with in an emergency or disaster? Things like communication and medical care, personal care, cognitive needs, transportation, participation. And then when we think about occupational adaptation, this is a client's effective and efficient response to occupational and contextual demands, right? So it's a really critical element when we think about the stages of the FEMA cycle, when we think about things like adaptive capacity, right? So doing things like preparedness through desensitization drills, the ability to adjust in the face of a disaster, as well as in a recovery phase. So these occupational performance processes allow us to sort of evaluate that process so that individuals can then integrate that and make additional adaptations. And then in terms of occupational justice, we believe as OTs, OT practitioners, that occupation and occupational engagement is a human right. And it's an issue that can be addressed at an individual and community level. So when we're considering large-scale disasters and emergencies, we can address mitigation and preparedness through efforts that look at communities. So just as I was talking about in the PEOP, when we think about it from occupational justice lens, are communities age-friendly? Are they disability-friendly? Are they mental health-friendly, right? We want to ensure that our communities features support occupational engagement, but also allow for safe evacuation and community support for individuals with a variety of different disabilities and needs. And we want to, really intersect those 3 theories. Now, the way that we intend to do that is to first introduce those 4 phases within the FEMA cycle, introduce these various theories, and then implement them through an implementation science framework called the Knowledge to Action framework. So how we equip individuals is really just what I mentioned there, that FEMA disaster management cycle and the other theories, but also it's important for us to all understand the history of occupational therapy in disasters. We have a rich history of this. Our nation has a rich history of various policies related to disasters, and then helping occupational therapy practitioners and students to understand our specialized role within each phase of the cycle within contemporary practice. And you all have already done a phenomenal job of some of the hardest identification of adaptive capacity and risk reduction within each of those phases, but you guys knocked it out of the park. So when we're thinking about enhancing the capacity of the OT profession, we want to be able to contribute to these public health and safety through community engagement, right? We want to be able to respond to community needs and vulnerable populations. And our trained pro technicians are going to be ready to work with communities and individuals. As I mentioned, we combine didactic, lab, and real world training, just like CARFIT. And then we operationalize that so that we can provide these services as certified experts. And so some of the other components of that training, we educate on the development of the occupational therapy test for emergency preparedness, which was developed by Dr. Tracy Nornhold. And so as occupational therapists, we consider roles, habits, routines, right, that are needed to mitigate, plan, and prepare for an emergency or disaster and how to respond and recover from it. So the purpose of this assessment is to develop a profile for the level of preparedness, followed by developing specific plans for action. And I'm really, really proud to say that I have 4 occupational therapy doctoral students who are working with me to begin the validation process for the use of this tool. We also have developed a manual, a technician manual, and within that manual in the appendix, we have documents that can be used with the profile that was developed from the assessment to begin to fill out these emergency plans. So, family member information, emergency plans, emergency contacts, et cetera, et cetera. This information can be found on ready.gov, but what we found is that it's not exactly accessible for individuals to jump on the computer and enter their information into ready.gov. But with our support, having this as a paper document could be really useful. We also encourage the use of role playing through the development of several case studies addressing a multitude of different conditions across the developmental lifespan. And so before students even get to these case studies, first, they administer the OT-TEP on themselves, on a partner, apply the results, right? And then they build their own kits. Because behavioral research indicates that behavior changes occur when training impacts your psychological attributes. So what that means is that by participating in the training and making their own plans and kits before working on those case studies, that you are then gaining experience in preparedness and increasing your empathy for vulnerable group preparedness. And so this experience will allow for enhanced outcomes in the preparedness of community groups. So as I mentioned, first, they practice on one another in their own individual plans. Then they move on to case studies, develop those plans, go through the OT-TEP, develop those plans, and develop additional items that might be needed for that case study's disaster preparedness kit. Some of us here on the call wrote an article that can be found in the DDSIS newsletter. And this is directly from that, some suggestions for what to include in a kit. Some of these are super obvious, but you should have a supply of water and non-perishable food for 30 days, at a minimum 72 hours. Things like flashlights, batteries, first aid kits, right? But also we should be thinking about essential documents, medical supplies, personal care items, ability to communicate, comfort and entertainment, and then any other special considerations, especially looking at regular kit checks in a way that we would do with our smoke detectors. So now I'd like to ask you another poll question. On a scale of 1 to 5, what would you say is your level of preparedness? 1 is not prepared at all. And 5 is I'm totally prepared with plans and emergency kits. I am very impressed. A lot of 4s. I like that. That's fantastic. I think possibly us being the group that we are here meeting tonight is an indicator as why some of you might have a 4. But, our first question really asked you, how important is it to prepare? And all of you said 5. Everybody said it's super duper important, right? And so we know as Americans, we know how important it is to prepare for an emergency. And yet us and the clients that we serve are not prepared. And the most vulnerable groups are at the biggest risk for injuries and mortality. The final pieces of the Project Protect curriculum is that trainees have to pass a knowledge test with 80% accuracy before they receive their certification as pro technicians. And then we can launch it to the community. So pro technicians can then go out to apply their training to help community members to develop personalized emergency plans and go bags. So during that training, you would identify a vulnerable group that you would want to go and serve. And then you would work with event coordinators, which at this time we are identifying event coordinators as the developers of Project Protect. And then actually go out, assess individualized needs, provide education on emergency preparedness, which is all prepared and ready to go, and ensure each person leaves with a plan and a kit tailored to their unique circumstances. So our idea is to really encourage and supply busy clinicians with everything you could possibly need to replicate this model. Oops. And then sustainability, we really want to be thinking about continuing this support and mentorship from occupational therapy practitioners who are really experienced to foster a collaborative and continuous learning environment and to seek out community partners.
And really, guys, this has been awesome for us to be able to participate. So we definitely want to thank you for engaging in this brief education and training. And we want feedback from the overview that we presented for Project Protect. What is your view on how well suited is it a method for training OT practitioners in the provision of the management preparedness at the community level as well as the individual level? And then we want you to also reflect on what steps will you take that maybe have been kind of pushed a little bit to the forefront for you to take on more preparedness at home or at work or in your community. So if you want to give us some feedback, either directly, we do have a slide that provides the email, and it is coming up toward the end. Otherwise, let's see. Yeah, if you see Emily's response there of if you'd like to participate in the validation process, we also have that going for the OTEP and for our Project Protect. And let's go to the next slide. And is there anything else that we didn't cover that you're like, hey, wait a minute, I wanted to know, is there something along those lines? Let us know now. And then there's our emails so that you can give us some information. And if you're not a member of our AOTA's community practice, this is the link that you fill in the enrollment survey. In fact, what we could do is try and put that in the chat as well.
Yep. I'll do that right now.
Thank you. So I know we had to push toward the end here to kind of get all that information in because an hour just doesn't feel like enough time.
Yes, Michael, to answer your question, we are presenting on Project Protect at the AOTA conference in Philly. So we very much welcome you to come to our workshop.
Some of us, yeah, go ahead.
We also are putting in a proposal for the World Federation of Occupational Therapy in Bangkok, Thailand in 2026. And Mary and I received fantastic news today. We received our contract with Elsevier. We will be editing a textbook on emergency preparedness and disaster preparedness in occupational therapy in the United States. Many of our authors are on the call tonight. And that textbook should be published and rolling out in 2027. So we're really very excited about that, and to be able to share far more detailed information than we could possibly give to you tonight. So I realize that it is 8 o'clock and we really did not leave much time for any questions. So please feel free to email us. Thank you for participating in the chat. I know it's not always the most engaging, but it certainly helps us to kind of keep to our time. So please send any questions to any of those emails. And please consider joining our practice chat, our community of practice, where we have meaningful conversations like this every month. And we also sometimes join other communities of practice to talk about the really specific kinds of intersections between disaster preparedness and, say, for example, the autism COP. So we certainly welcome anybody who might like to host us or who might like to come to join us at the COP. Thanks, everybody.
Thank you. And thank you, Michael and Sandra, for being here, and Dina for supporting us.
Yeah, thank you so much. I think maybe we should have a redo practice chat, just because
Ooh.
not everybody could come tonight. So maybe something in February or March.
Certainly happy to present at any point. We're also willing, I shouldn't speak for Mary. Mary has a more limited schedule than I do, but I'm also happy to provide any content to you, whether it's through your state associations or other mechanisms. Just reach out to me. I'm happy to do that.